But as the legislature, it's incumbent upon us to make sure that patients are protected. And that's really, at the end of the day, what this is about. The prescription benefit managers negotiate prices for prescription medications. I have legislation that encourages that competition up front, that allows the legislature to have more of a role in monitoring and overseeing and demanding accountability from these companies.
I'm State Senator John Burzichelli.
I'm Assemblywoman Heather Simmons.
I'm Assemblyman Dave Bailey.
And this is another episode of Statehouse Minute. You know, legislation touches a lot of people, but it can be pretty boring, but it's very significant. Heather, you've taken a significant lead in a few critical areas, particularly in the healthcare game, not just a game, but important. Why don't you bring us up to date?
Well, thanks, John. One of the areas where I've been taking leadership role on the Assembly Financial Institutions and Insurance Committee is in what we call PBMs. The prescription benefit managers negotiate prices for prescription medications between the pharmaceutical companies and the insurance companies. Practically speaking, they're helping to set the rates for insurance and for what prescriptions cost us on an everyday basis. So I have been leading the charge in encouraging the state treasury to go out to bid for a new contract with a new PBM. And I'm really gratified that earlier this year, the state treasury has gone out for a new contract with the PBM. So I have legislation that encourages that competition up front. And then I have backup legislation that encourages a real study of what the realized savings are in these contracts that allows the legislature to have more of a role in monitoring and overseeing and demanding accountability from these companies.
It's real important stuff, by the way. What Heather just described, that's a middleman, and they're not always working on our side, by the way. So the idea is to try and get our arms around it, as Heather just described. Very, very good work.
Well, John, the fact is, as someone who does have what could be categorized as a catastrophic illness, maintenance drugs and drugs that help people like me on an everyday basis often go up and down, are available, are not available, not because of decisions I make as a patient with my physician, but by decisions that are made by for-profit corporations. The PBMs are part of that. They're not the only players in that system, but as the legislature, it's incumbent upon us to make sure that patients are protected. And that's really, at the end of the day, what this is about.
It's the right theme. And we'll be back with another Statehouse Minute episode. This is our podcast to keep everyone informed. Make sure you follow along. Don't miss anything.